Hi, my name is Sarah Rosenfeld Johnson. I'm a speech-language pathologist, but I also specialize in feeding therapy. A number of years ago, I was asked by a parent group to make a short DVD telling parents of children who had just delivered a child with any type of feeding disorder or problem what they needed to know how to do now. There are so many things you can do as a parent right now to maximize the development of your child. When I lecture, I teach speech pathologists and occupational therapists about feeding, and I generally say in those presentations, I wish I had 15 to 20 minutes to speak to the parents of these children when they are still in the hospital or shortly after, to tell them what they can do to prevent some of the issues that are frequently associated with children who have muscle weakness, which in this case is your child. But before I talk about what you need to do, let me do what everybody should do first, and that is just say congratulations on the birth of your child. You're not alone. We're going to try to be here to help you. You have lots of therapists that are going to be coming in and out of your life who are going to give you information, who are going to try to help you to maximize, again, the speech movements and also the feeding for your child. So let's begin. I've made a short presentation just to organize all this information for you, and I hope that it's something that helps you. The name of this presentation that I've created is called Oral Placement Therapy: What a Parent Needs to Know Now About Feeding and Speech Development. A lot of times you're told that it is not important to see a speech pathologist early on because speech comes in later. But it's important to understand that the muscles that are used in feeding are the same muscles that are used in speech. So you can do something right now to help your child. There are some common characteristics that I want to talk to you about that relate to both feeding and speech. The first is what is called hyposensitivity. It's important for you to understand that children with muscle weakness and hypotonicity, which is very common in the diagnosis of Down syndrome, also have reduced sensation to touch, meaning that if you touch them here, they will feel it less. They also have reduced sensation to taste. So the foods that you give them should be higher in flavor. That's something you're going to need to remember for a number of years. They also do generally better with foods that are very crunchy because that gives the auditory or the ability to hear those foods. But I think the most important is that so many of the families that I've worked with over the years will tell me that their children have adult taste buds. And what that means is that they like stronger flavored foods and therefore will chew them better and have a better diet. The next area is low muscle tone, oral hypotonicity, weakness in the muscles of the abdomen, velum, jaw, lips, and tongue. Now don't get scared by that. What that means is that the muscles for speech are a little bit weak. But we can correct those in the same way that you could improve muscle skill if you went to the gym and exercised. So all of the things that I'm going to talk to you about today are things that you can start working on now, and I'm also going to show you some pictures of some of my clients who have used this particular type of intervention, who have normal speech and have a very beautiful, lovely, adorable face, which we all love. Number 3, there is usually a significant gap between receptive language, and that would mean what a child understands, and expressive language, what a child wants to talk about, and speech clarity is what a child can say clearly. Our goal for you is that whatever your child wants to say, everybody can understand, not only you. And that's going to be a very important part of the relationship between you and a speech and language pathologist. Number 4 is that there is a high degree of conductive hearing loss. Conductive hearing loss means that there is fluid or mucus in the middle ear. I'm going to talk to you about some techniques that you can use now, which will prevent that from happening, which will give your child a better chance to be able to hear normally throughout their lives. There are also characteristic facial appearance which you might be aware of. But with this type of therapy, we are working very hard to give your child a more typical kind of look. And I know that might sound weird, but communication between people is based on the desire to talk to each other. And if children have a look that is more typical, that becomes a very important factor in interactions between children, their peers, and other adults. And I want to show you the good news as we go through this. There's some important information I think you need to know about feeding. Feeding position and placement are important for infants with the diagnosis of Down syndrome. And I'm going to give you some general ideas, but it's important for you to find someone to work with as early on as you can if you are having trouble with feeding. There are nutritional concerns, obviously. We want to make sure that your child has the skill to chew enough or as well so that your child can have a complete diet. It's also important to know that the muscles used in feeding are the same muscles used in speech. So you can be working on a feeding program right now which is going to improve your child's speech clarity in 2, 3, 4, 5, 6 years from now, which is very important. And here is the most important thing to remember. No matter what bottle you use, or if you are breastfeeding, remember to keep the ear higher than the mouth at all times during breastfeeding or bottle feeding to prevent liquid from going or entering into the middle ear. There are very small muscles at the base of what is called the eustachian tube. If you are holding a child with the ear lower than the mouth, it is a possibility, because these muscles are not working as well as they should, that milk or formula can go in their ears. It's important for you to remember to keep your child in a position where the ear is higher than the mouth at all times. Here are some do's and don'ts. Do. A pacifier. A lot of people will say to you, don't use a pacifier because it stimulates a tongue thrust. But in an infant with the diagnosis of Down syndrome, a pacifier is a good way to exercise the mouth and the muscles in the oral cavity, the oral structures, so that your child can feed more successfully. When your child no longer needs a bottle or is no longer breastfeeding, so no longer needs what is called a suckle pattern or a back and forth tongue movement, then you have to remove the pacifier. A pacifier does something else. It keeps your child from putting the thumb in the mouth. If a child learns to suck their thumb, it's much harder to eliminate that habit than it is to throw away the pacifier. So please think about that. When you are choosing toys for your child to play with, hand-to-mouth control later on, it's important to choose toys that they do not suck on. Again, we don't want that forward and backward tongue movement, which is so common in the diagnosis of Down syndrome. We want toys that they can bite on. Biting encourages the tongue to be retracted or back in the mouth. Talk to your child. Sounds like a silly thing to say also, but a lot of parents choose to use baby talk with their children, and that is not going to help your child. We want your child to hear standard speech. So if you're going to say, aren't you cute, don't say, oh, you're so cute. You want to say, aren't you cute, with a smile on your face to give them that positive reinforcement. But we don't want to give them models or things to imitate that are going to hurt them in the long run. As related to the last part of the talk, highly flavored foods are something you really want to think about as you progress and develop your child's diet. Don'ts. Don't do raspberries. Although they are cute, is not something we want your child to imitate. We want your child to imitate speech sounds or movements that are made with the tongue in the mouth. Once a child develops those raspberries, it's very, very hard to get rid of them. And what it does is pushes that tongue forward. Another thing that pushes the tongue forward is pressing on the tongue tip. If anybody tells you to press on your child's tongue tip whenever you see it come out, you ask them why. Give me a reason to do that, because the real reason why you shouldn't is when you press on something, the natural reaction is to press back. Therefore, if you press on the tongue tip, it may go in for a second, but it's going to come out with a vengeance, and we don't want that. Don't press down on the tongue blade either. Some therapists might say to you, or a parent, a friend might say, Put the spoon in and press down. Don't do that, because if you press down, that will again cause the tongue to push forward. Try these things on yourself so you can see that this is exactly what happens. Mixed textured baby foods. As you progress through spoon feeding activities, there are baby foods called stage 3. They have mixed textures. They have pieces that you need to chew, and they have purees that you need to swallow. It's very difficult for children with muscle deficits to separate those foods in the mouth. So what they do is they learn to swallow pieces whole, and they don't chew. You want to make sure that whoever you are working with, whether it is a TalkTools therapist or a therapist from any other location that you're working with, you want to make sure that when you go into solid foods that they're placed on those back molar or back molar ridges. Work with a speech-language pathologist as early as possible to normalize the muscles needed for safe feeding and speech clarity. If your Birth to 3 program tells you to wait a couple of years for a speech therapist, you say, no, I want one now. Remember that we work for you. We are speech and language therapists, so we want to be both with your child. Speech therapy reaches or teaches the muscle movements needed for safe feeding and speech clarity. Language therapy teaches the words and word order we use when we speak. Your child will need both to reach his or her maximal potential. One or the other won't do it. Only language therapy or only speech therapy. We want them together. As your child is learning to speak, we want them to speak clearly. I want to introduce you to one of our clients. This is Martha. Martha I did not meet at birth. And when you look at your child now, this beautiful baby that you're holding in your hands, you're going to notice probably that she or he is breathing through the nose. Lips are closed. There might be a little tiny bit of tongue protrusion. No hearing loss. None of the characteristics associated with this diagnosis. And that's how Martha started her life. Then, a year later, I met her because her mother and father were not given the right information. And unfortunately, they were not feeding her with her ear higher than her mouth. And she developed a lot of mouth breathing, congestion in the nose, lots and lots of movement patterns that are related to the position that I'm talking about. So a year later, when she came to see me, you can see that her tongue is protruded, and that her lips, the lower lip, is very bulbous kind of looking. Then you look at Martha later, and after many years of therapy, she has what we would describe as a typical face. She has normal speech, and if you close your eyes and talk to Martha, you have no idea that she ever had any diagnosis. She did a lot of work. But unfortunately, she had to go from here to here and then to the normal skill. What we are hoping for you is that you won't have to go through that interim stage where the tongue protrudes. These are our babies. These are children with Down syndrome who have never had a tongue thrust. They've never had tongue protrusion, and they are as adorable as they could possibly be. Some information for later on. Just to keep in mind, I know that you're not going to think about this now because this is way in the future, but hold on to this disc, and when someone says to you it's time to use a sippy cup, go back to this and look at it. Sippy cups are not appropriate for your child. Sippy cups encourage a tongue protrusion. It is like being on a bottle. There are a variety of different therapy techniques and cups that you might consider with your therapist, but a sippy cup should not be one of them. Straw drinking. We teach our babies with Down syndrome, as you can see in this picture, somewhere around 6 to 7 months of age, how to drink from a straw using a honey bear. Straws used in a hierarchy will prevent tongue protrusion. That's one of the techniques we use, and you can see this mother working with her young child using a honey bear. These are, I'm not going to talk to you about how to do it now. That is not what you're ready for. What you want to know about is what you have in the future, and these are therapy tools that will be available to you. Teaching infants how to chew using non-food items. This is something you can do right now. We're going to eventually give your child solids, which not purees, but foods that they will need to chew. Right now, you can start by taking your pointer finger, holding your baby in an upright position so his or her ear is higher than the mouth. Put your pointed finger on the gum ridge. When you do this, you're going to feel your baby bite down. Stay in that position because that is called a phasic bite. It's a reflex now, but if you do it over and over again and go to the other side, that's going to change that reflexive movement into what is called volitional control for chewing. And I'm showing you here some of the options. We do the gloved finger first, just an up and down movement. When you get to 10 on the right and 10 on the left, you'll go to another therapy tool, which is called the Infident. Now, all of this information is available through TalkTools. You may choose to do it or not. That is up to you. I just want you to know it's out there for you. There are specific exercises that can be given to you when you are ready. But these 3 therapy tools, your finger, which you don't think of as a therapy tool, right now is keep the ear higher than the mouth, finger in the mouth, and biting on it. When you put your finger in the front, that creates a suckle movement, which is okay if you're going to do it right before you breastfeed or bottle feed. But any other time, you want to go on the gum ridge, right and left side. When you're ready to give your child food, and we're talking about solids, maybe Cheerios or pieces of cut up banana, please make sure not to put them on their tongue, put them on the back ridge. I'm showing you here a mouth. I'm showing you the placement. It doesn't have to be on a tooth. You don't need all these teeth to placement, but I wanted to show you where it goes. Please do not put food on your child's tongue because that will encourage them to suck it. The placement is going to be from the side. It's our mission statement at TalkTools to provide the very best programs and therapy tools to help you and your child. We are available for all questions, concerns, or issues throughout your child's development in the areas of feeding safety and speech clarity. You are not alone. So please visit TalkTools.com for more parent resources. Email us. We have many therapists who will email back and forth with you if you have any questions. And again, congratulations on the birth of your beautiful, beautiful child.